But survivors are also telling us a number of other things. They want you to tell them how they can reduce their risk of having these morbidities associated with their cancer, keeping their cancer from coming back. They want you to tell them, do they need to be worried about their families? What kind of genetic risks do they need to be concerned about? They're frustrated that you don't have the answers, that we don't have the answers. And at the same time, we know that this can be, for many individuals, this teachable moment, a window of opportunity when people are really ready to make or willing to make sometimes quite radical changes in their lifestyle and behavior, because this has been such a toxic experience for them, in particular with their daily habits. And this presents, for many, and institutionally presents a whole opportunity to develop programs to look at lifestyle and behavioral modifications. These are a suggested chart by Wendy DeMarco, who used to be at Duke, is now at MD Anderson, suggesting the kinds of impact that just lifestyle and behavioral modifications might have on common problems like depression, fatigue, changes in body composition, functional decline, or comorbid status in our cancer survivors, simply by encouraging individuals to engage in some of these behaviors. And in fact, one of the fastest moving areas of research, we probably have about 24 studies supported at the NCI, is looking at physical activity in our cancer survivors, in part because there's been very provocative data from our nursing colleagues who found that this is very helpful for managing some of treatment side effects, but even more compelling data out of some of our observational studies, in particular the Nurses' Health Study, Michelle Holmes' analysis of data there on breast cancer survivors, and then data that's come out of CALGB, and also the the Nurses' Health Study looking at colorectal cancer survivors, suggesting that moderate levels of physical activity, the kind of Surgeon General's level that we're all supposed to be engaging in, actually prolongs survival. It's not just improving quality of life, but actually quantity. These are very provocative data. Again, they're observational. They need to be tested in regular clinical trials in some way. But this is something that survivors are telling us they're interested in doing. It's something everybody can do, could do, with support and encouragement. And I think in particular, we know our oncology communities are gatekeepers. If you were to say, I think this is really important for you, I think you ought to consider it, can I refer you to somebody for counseling on this? That includes, and I'm glad Kristen McNiff preceded my conversation because she showed you that smoking data. If you have a patient that smokes and you're not referring them for counseling, shame on you. This is one place where really we can make inroads. We have evidence-based interventions in here, and it really is a lost opportunity not to step in. And in particular, physicians can make a difference in this. I don't mean to diminish or dismiss nurses, but when patients tell us their physician says something, I don't care if your wife or your husband's nagging at you for years, or your kids actually have a little more leverage in here. But when your physician says, you really need to be doing this, I'm very worried about your health outcomes, you can often get people in the door. So I'm going to make a main point of that.